We have 4 veterinarians here from Winslow Animal Hospital, Dr. Kudre and his wife Lee, Dr. Levie, Dr. Hinze, and Dr. Bohn. We do a lot of work with Winslow Animal Hospital. We refer a lot of clients to them. They're probably the best veterinary practice around. That's how highly we think of their veterinary prowess, so to speak. And they have a lot of different things they do, from ortho to general veterinary care, acupuncture, physical therapy, a lot of different things going on at Winslow. And they've agreed to come out and do a couple seminars for us from time to time. What we're trying to do as dog trainers and for the total care of your dog is not just deal with a training issue, because there's a lot of things underlying that can affect your dog. Their behavior, the health of the dog. They have ortho problems, and a lot of that's missed that we pick up that there's a problem. I don't know what the problem is, but there's a problem. And then we send them to Dr. Kudre. Dr. Levie was sending a lot of patients too. Dr. Hinze, Dr. Bohn, you just came back to the practice recently.
Damn.
So
Damn.
what we're saying is, when we deal with such a high volume of people and their dogs, we want to be able to send them to somebody that we trust. Now, everybody has their own vet, I get that. And we're not trying to say, well, you got to go to Winslow. You got to go to Winslow. You don't have to. I'm not saying that. But if we can further educate you about your dogs, whether it's dental health, which we're doing tonight, or whether it's some ortho stuff, there's all different kinds of things that we see, because we deal with literally hundreds and hundreds of dogs a year, okay? So we get pretty well educated on picking up problems. It's not my job to figure out how to fix it. It's their job, because we're not veterinarians. So that's kind of where we're at tonight. This is the first of, hopefully, it'll be a few different things that we're doing, okay? So we're going to introduce you to Dr. Kudre. He'll take over the show.
Thank you. So I want to thank you all for letting us take your time tonight to give you a little bit of education on dental disease and dental care for your pets. Very, very important topic. And we have, as I mentioned, 3 doctors are going to be speaking tonight, starting with Dr. Linda Bohn, and followed with Dr. Levie, and then bringing up the end is going to be Dr. Hinze. So I'm going to go ahead and let Linda Bohn start her presentation.
Hi everybody, welcome to Winslow Animal Hospital's dental workshop. I'm Dr. Linda Bohn, and I'm going to be speaking to you about consequences of periodontal disease. So I think we're all pretty aware that we need to pay attention to our dog's dental health, but I think sometimes the more severe consequences of periodontal disease, sometimes we're not that familiar with it, we're not as comfortable with some of those things. So I hope to shed a little bit of light on some of the things that can happen with periodontal disease besides just bad breath or tooth loss. So let's start out with a little cartoon. It says, the owner's saying, remember your toothbrush is green, mine is blue, and at the bottom it says, Bob would learn the hard way that dogs are colorblind. Periodontal disease is one of the most prevalent diseases in dogs and cats, but it's also one of the most preventable. So what exactly is periodontal disease? What's the definition? And it is the inflammation of some or all of the tooth's deep supporting structures. Bacteria in the mouth will form plaque, which when combined with salt and minerals forms calculus. And this causes gum irritation and leads to an inflammatory condition that we're all familiar with called gingivitis. But in time, that calculus will build up underneath of that gum and it'll separate it from the teeth. Spaces will form in that separation, and this will help to foster bacteria growing. And once this happens, periodontal disease will occur and will lead to bone loss and tissue destruction and pus formation between the gums and the teeth. So in other words, our patient has a dental infection. And this particular picture just really shows a severe case of periodontal disease that defines all of those things that we just talked about. We have 4 different stages of periodontal disease, from 1 to 4. We'll start out with stage 1, which is just some gingivitis. We might have a little bit of tartar getting formed. But this stage you can very easily turn around with some basic toothbrushing, which I think we're going to talk about a little bit later. stage 2 is when we start with some early periodontitis. I know it looks like it's a little bit out of focus, it's hard to read that, but basically we're starting to get more gum inflammation, we're starting to get more plaque formation, more calculus formation. And you might start to notice here where your dogs are starting to get some bad breath, and they might start to get a little bit of pain involved. Stage 3 is more severe periodontitis. At this point, our gums might be bleeding, and we're starting to get more of the infectious stage of periodontitis. And then our last stage, stage 4, is where we actually have so much infection present that we might start to be seeding the organs like the heart and the lungs and the kidney through the bloodstream. So this is just on the left a picture of probably about a stage 2, maybe starting to get towards a stage 3 periodontal disease. And the slide on the right shows you what the mouth is going to look like after that dental cleaning. So not only are we going to get a better appearance, but we've also got other health benefits from that as well, getting rid of that bacteria in the mouth. So what else is going to happen if periodontal disease is left alone? And we have consequences for our body systems. There's evidence that periodontal disease affects the health of many different body systems, and we see changes at the cellular level in the heart, lungs, kidneys, and liver. And research regarding these changes just shows the association between that inflammation in periodontal disease and cardiovascular disease, respiratory disease, liver disease, and kidney disease as well. So cardiovascular disease is our most common secondary problem that we're going to see with periodontal disease. And bacteremia, by definition, is bacteria in the bloodstream. And that bacteria can enter the circulation and cause degenerative changes in the heart and in the blood vessels. And it can cause infection and inflammation of the heart and the valves and the heart muscle also. So this is basically an illustration of how that bacteria can damage the heart valves. At the top we've got a picture of a healthy heart valve, but on the bottom it shows the damaged valve that has bacterial growth present. Basically, we're going to have heart failure occur when we have these valvular changes over time. So respiratory disease can also happen from periodontal disease because that bacteria from the oral cavity is basically being aspirated in the saliva, and then we're getting chronic obstructive pulmonary disease, bronchitis, and damage to the lung tissue. Kidney and liver disease has also been a consequence of chronic low-grade bacteria in the bloodstream that's associated with that periodontal disease. And liver disorders that we see sometimes can be hepatitis, which is an inflammation of the liver, and local fibrosis, which is scarring of the liver. So in addition to all these body system diseases, we also have local consequences as well. And those can be oral nasal fistulas, jaw fractures, tooth-root abscesses, and resorptive lesions. We'll kind of go through what each of those things are. An oral nasal fistula is basically caused by progression of the periodontal disease up into the palate, which results in a communication between the oral and nasal cavities, which can create an infection that we call sinusitis. So this is a picture of an oral nasal fistula where our periodontal disease has basically eaten up into that palate, and now the oral cavity is communicating with that nasal cavity. So what are some signs you might see if your pet has an oral nasal fistula? We might see sneezing, we might see some chronic nasal discharge, we're going to see some inappetence, and definitely some bad breath odor going on there. So there also could be a possible link to cancer with this. There's been some recent studies that have showed a link between periodontal disease and oral cancer. This association is probably due to the chronic inflammatory state that exists with that periodontal disease. These are some pictures of oral tumors. These aren't necessarily from a periodontal disease case, but I just thought it might be helpful to see, what some oral tumors might look like. In this particular case, it's a kitty cat. So another consequence that we can have of severe periodontal disease is jaw fracture. And this occurs due to the bone loss in the mandible that happens from the chronic infection and inflammation. So I've got a couple of x-rays to show you what that looks like. Right here in our jaw, this is where our mandibular fracture is occurring in that particular radiograph. And then in this one, we've got complete fracture all the way through that mandible, and shows a really extreme example of mandibular fracture. So one of the most common things though that we're going to see is a tooth root abscess. So this occurs when the root of a premolar tooth becomes infected. It'll often break open and drain to the outside skin right underneath that eye area. But the first thing that you're going to see is that your dog is going to have some facial swelling right underneath of that eye. And this is a photograph of a dog that has that facial swelling. So right here, right underneath of that eye is where we're looking at. And this shows why that's going to happen. So we've got the premolar tooth here, the carnesial tooth has very long roots. And when that root gets infected, that's where it's going to swell and it's going to break open and drain right underneath of that eye. This is an x-ray of a tooth root abscess. Again, we've got our tooth root right here, and then that darker area right above it is where that abscess is occurring. So resorptive lesions are something that we see very commonly in kitty cats. The root of the tooth becomes absorbed. In other words, it's starting to disappear. It's very, very painful, and that tooth has to be extracted to relieve the pain. We've got an x-ray of that as well. Kind of see just how we've got like a little chunk out of that tooth right there, and that's our resorptive lesion getting going. So in conclusion, periodontal disease is the most common, but yet the most preventable disease in dogs and cats. And prevention of periodontal disease is also going to help prevent systemic and local disease processes.